Good morning and welcome to our webinar, Fentanyl Crisis. My name is Dr. Erica Torres, Deputy Superintendent of Public Instruction for the California Department of Education. Today's webinar will cover key initiatives and perspectives on the fentanyl crisis. We will feature student and educator-led efforts to raise awareness among peers, hear a personal story from a parent who will discuss the dangers of counterfeit pills, and gain insights from a school nurse on trends, overdose signs, first aid responses,
Public.
market use, and prevention strategies. Additionally, we will receive an overview of the new drug talk and learn about the resources available from the California Department of Public Health for overdose preparedness and prevention. Please note that our webinar is being recorded and live streamed. We encourage you to use the Q&A feature to type your questions. A Q&A session will be facilitated after we hear from our presenters. But before we proceed, I would like to take a moment to acknowledge that during today's webinar, we will hear from a parent. She's going to share a personal testimony, and she tragically lost her son due to a counterfeit pill. And so this story is powerful and deeply moving, but it may evoke strong emotions. If at any point you need a break, feel free to step away and take a moment for yourself. Remember, it is really important to prioritize your well-being. Throughout our webinar, we will provide critical resources and information to support you in addressing the fentanyl crisis. Thank you again for joining us today. It is now my pleasure to introduce our State Superintendent of Public Instruction, Mr. Tony Thurmond.
So for this opening remarks, thank you to everyone who's joining us to have this conversation today. I want to start by acknowledging that the month of May is Mental Health Awareness Month, and that to remind everyone that sometimes we all need help, and that it's important to reach out when you do, and that if anyone who's following the Zoom needs help in addressing depression or anxiety or any kind of mental stress, you can always reach out to 988. You can text or call that number 24 hours a day, 7 days a week to get help with anything. And so they will listen and they will help to connect you to resources. And so let us continue to support all of our loved ones who experience mental stress of any kind at any time by using 988 and other mental health resources. I want to thank all of our partners who are here today for this conversation about how we prevent young people from experiencing the effects of fentanyl. As you all know, we've had a dramatic increase in the number of people in our state who've lost their lives from fentanyl overdoses. To put it in context, going back to 2012, when there were about 82 lives lost to fentanyl, now to the data that we have from 2023, where there were more than 6,000 lives lost. This is so hurtful and painful, but it can be prevented. It is our responsibility to approach the fentanyl crisis in many ways. First, with education and prevention and helping young people to get access to information to how they can be safe. We also have to do all that we can to provide treatment and intervention, whether it's substance abuse treatment of any kind, counseling, mental health supports, wraparound supports, to provide those kinds of supports. And to all of the school districts that are represented here today, just remember the federal funds that you have allow you to use those dollars for education and prevention, and that there are many partners who can help us with treatment supports. I want to thank all of the partners at the California Department of Public Health, who you'll hear from today, who have great education for us. This is a public health issue. They help us, and they make naloxone available to our schools. And there's been legislation to make sure that there's naloxone available in colleges and higher education. But through action taken at the state, we have resources for school districts to be able to acquire and access naloxone in the event that there is the opportunity to save a life for someone who's having an overdose from fentanyl. And so we hope that you all will avail yourselves of the resources that are here today to save a life. I want to give special thanks to Faris Al-Mahamid, a student from Lomas High School, who shared remarks today and who's been a great student leader of a group called Peer to Peer, a club that is dedicated to educating students about the dangers of substance abuse. And thank you, Faris, for your volunteerism in hospitals and working with patients. And we understand that you aspire to be a neurosurgeon, and we look forward to your journey and becoming a physician and a scientist and a researcher who can help us in all of these ways. And I want to thank Laura Didier, who you'll hear from, who works at Song for Charlie. Laura is an incredible mom, leader, friend, mentor to me and others, who has taken her personal tragedy in losing a son due to fentanyl and using her experience to help others, and passing legislation to make sure that we have a electronic portal to educate schools and families about the dangers and risks around fentanyl. And I just want to say thank you, Laura, for all you do for young people and families and educators and public health advocates all across the country, and especially right here in California. And so thank you, everyone, for joining the webinar today. I look forward to the resources that will be shared and exchanged. Look forward to the questions that will be raised and the suggestions of what we can do to make sure that we can help young people and families going forward, to keep them safe and to protect them from the dangers of fentanyl. And thank you for everyone at the California Department of Education, our staff and our team who have curated this webinar and are putting together resources to partner with our school staff and all of our school health centers, our school mental health staff, our teachers, our classified staff, our administrators, our parents and volunteers. Thank you all for what you do to keep California students safe. And with that, I'll turn it back to Dr. Torres and the rest of the team to facilitate the rest of today's conversation.
Thank you so much, State Superintendent of Public Instruction, Tony Thurmond. We appreciate your leadership, your vision, your ongoing support. We appreciate you joining us. So next, I would like to introduce Dominic Robinson. He is the Director of the Whole Child Division for the California Department of Education. Welcome, Director Robinson.
Thank you, Dr. Torres, and good morning to everyone. Thank you for joining us today for this critical discussion on the fentanyl crisis impacting our students, families, schools, and communities across California. Again, my name is Dominic Robinson, and I serve as the Director of the Whole Child Division here at the California Department of Education. It's an honor to welcome you all to this important webinar. As we come together today, it's essential to recognize the severe and far-reaching consequences of the fentanyl crisis. Fentanyl, a powerful synthetic opioid, has been responsible for the tragic surge in overdoses and fatalities across the state. This crisis doesn't discriminate. It affects people across all demographics, socioeconomic statuses, and communities. So today, we aim to shed light on this epidemic, share crucial resources, and provide strategies to support our students and school communities effectively. We're dedicated to the health and wellness of every student in our state. This commitment drives our efforts to ensure that our schools are safe havens where students can thrive academically, socially, and emotionally. And today's webinar is just part of our ongoing school safety webinar series, which focuses on addressing the most pressing issues affecting our school communities. We have assembled a distinguished panel of experts who provide invaluable insights and practical information to help us combat this crisis. We deeply are grateful to our State Superintendent of Public Instruction, Tony Thurmond, for his vision and unwavering commitment to prioritizing school safety and health and wellness of all of our students across California. But the fentanyl crisis is a complex and multifaceted issue that requires a coordinated response from all of us: educators, parents, health professionals, and community members. So today, we want to do this together. Thank you again for being here. Your presence demonstrates your commitment to the well-being of our students and communities. I would also like to extend another gratitude of thanks to our program partners for their invaluable support. Now it's my pleasure to introduce you to Dr. Carrie Sequeira, our administrator over the Office of School-Based Health Programs within the Whole Child Division. Dr. Sequeira has been an advocate for student health, and she, along with her dedicated team, have worked tirelessly to make today's webinar possible. Dr. Sequeira, let's get started.
So thank you very much, Director Robinson. My name is Carrie Sequeira, and I am the administrator over the Office of School-Based Health Programs. We are very excited to present information today about the fentanyl crisis that our school communities are facing. I would like to first introduce Amelia Whalen and Faris Alma Hamid. Ms. Whalen is a licensed clinical social worker who has been working in public education for the last 10 years and was a county social worker prior to entering public school education. She currently oversees the Los Lomos High School Wellness Center. In this role, she provides clinical support to students and coordinates student programming around wellness-related topics. She developed and implemented the school's initiative targeting fentanyl awareness and education. She's highly dedicated to ensuring student safety and understanding surrounding the topics of fentanyl and naloxone. Faris is a senior at Los Lomos High School and plans to attend the University of San Francisco under the major of neuroscience in the fall of 2024. During his high school years, Faris ran an organization called Peer to Peer, a club dedicated to educating other students about the dangers of substance abuse. Additionally, through many volunteer hours in hospitals, Faris has gotten a great deal of experience interacting with patients and executing fundamental hospital tasks. In the future, Faris aspires to be a neurosurgeon and is determined to accomplish his goal. Ms. Whalen and Faris, you want to take over?
Yes, thank you so much. My name is Amelia Whalen. I oversee the Wellness Center at Los Lomos High School in Walnut Creek, California, within the Acalanes Union High School District. Much of what we do in wellness is provide direct clinical services and case management and information regarding referrals for our students and parents. And we do a lot of programming around wellness-related topics as well. Over the last 2 years, we've always focused on issues surrounding drug and alcohol use with our students, but over the last 2 years, we've really kind of really dug into the topic of fentanyl and naloxone and ensuring that our students and our school community are aware of what's happening in terms of that epidemic. Really, it was important to develop a multi-tiered systemic approach to addressing this issue to ensure that all members of our school community were aware of it and what we can do to keep our students safe. An important piece of us implementing this initiative was really getting buy-in from our teachers and educating them around the topic of fentanyl. We did this by doing a presentation to all staff members, both myself and the school nurse, where I focused on the epidemic itself, the impact it has on teenagers, academic implications, and also what it can mean for school safety, while also discussing available supports that they can connect students to through the Wellness Center, such as our alternative to suspension program for substance use, and also providing support to families when there's a substance use issue that goes beyond the scope of what we can provide as a wellness center. As part of this professional development, our school nurse trained all of our staff members in how to recognize the signs of overdose, about Narcan and naloxone, and also how to administer it, and also our school safety protocol surrounding that. After all of our staff members were trained, they were given the option to have Narcan within their classrooms. And what we found was we had a lot of teacher buy-in after they had this information. And now we have Narcan in more than 30 classrooms at our school. And also administrators and our school nurse and the Wellness Center has it as well. A really important component of this initiative has been parents and educating them around the issue and how they can support their kids and impart the knowledge to them as well. We've done a number of presentations over the years, specifically around opiates and fentanyl to parents. And this year we implemented a new format along with the support from Song for Charlie. What we did was a community panel education night, which started with us showing the documentary, The New Drug Talk, which was developed by Song for Charlie, which presented a really wonderful balance of the information around this issue, but also really grounding it in a human component, like a human component that really, I know, drove things home for parents. As part of the panel, myself, Laura Didier from Song for Charlie, Ferris, who I'm going to introduce you to in a moment, a substance abuse expert from our community, Dr. David Hahn, and one of our school administrators were present for a question and answer after the documentary screening. We found this format to be incredibly successful in terms of encouraging community connection with the school, really promoting discussion with parents, and also their participation in terms of spreading awareness around this issue with our students. One of the key components of us really addressing this issue has been directly targeting our students and their education around it, and also opportunities for them to contribute. One of the things that we've done pretty consistently is done small group presentations around fentanyl, but then it's really important to us that what we do reflects the needs of our students and that we're very responsive to their feedback. And much of what we heard was having opportunities to interact with each other and connect, made for a much more effective educational experience for them. So we developed this format called Fentanyl Awareness Circles, where students still receive the information about the fentanyl epidemic and fentanyls and prescription drug abuse, and also Narcan and what it is and how it's administered. But throughout the information being presented, there are opportunities for them to connect with each other and discuss the issues. And we always ground these in opportunities for students to feel empowered and become involved. So we always want to impart to the kids that they can do something to help each other and to keep themselves safe. This year, we had a school-wide assembly where we had Laura Didier, who you'll be meeting, from Song for Charlie, come out and educate all 1,600 students at our school about this topic. Laura presented a lot of really important information about the epidemic and also shared her personal story, which was incredibly powerful. This assembly had a huge impact on our school community and our students. Students talk about it, and we intend to have this be an annual thing that we do because of the success that we saw from it. We also, through wellness and with the help of students promoting it, had Fentanyl Awareness Day. We observed that earlier this month. We drew upon a lot of the materials from Song for Charlie in this, and having students take a pledge not to take or distribute any random pills. We also provided resources, and also the one pill can kill bracelets that Song for Charlie kindly provided to us. And we showed a screening of The New Drug Talk, which is the documentary that was shown to parents as well. One of the most important and powerful things that I think has happened here has been the Peer Awareness campaign. Our goal is really to empower students in this and really, give them a voice and be responsive to what they need and what they're seeing, because they are experts in themselves. They will always know more than us as educators. We really always look at our internal capacity, and I really believe that our students are our greatest resource. And what we've seen in this has just demonstrated that. It was really important to us not to have all of this be siloed within wellness and for it to permeate to the broader school community. And we're so fortunate to have the student group of peer health educators on our campus who we're able to partner with and really brainstorm ways to let students know about naloxone being available on campus, and also the dangers of fentanyl and random pills. So I'm going to turn things over to Faris Al-Mohammed, who is the president of our peer-to-peer educator group, so he can tell you a bit more about the group and the amazing work him and the other students have done around this topic.
Next slide, please. Hey everyone, I'm Ferris, and I just want to speak a little bit on my experience on promoting awareness on dangerous drugs such as fentanyl from the student perspective. I'm currently a 12th grader at Los Lomos High School, and I run a club called Peer to Peer, where I work with the Los Lomos School Nurse and Wellness Center. Next slide, please. My mission with peer-to-peer is to educate other students about the consequences of abusing substances while also promoting a no judgment environment. I've observed a lot of young people feeling shameful about their addictions, so at peer-to-peer, I believe that it is important to emphasize that an addiction is nothing to be ashamed about. Moreover, it is important for students who may be struggling with substances to understand that there are people who are actively supporting them. In this way, students may feel less isolated and possibly will be more willing to seek help with their addiction. Next slide, please. Moving on, I'd also just like to touch on some of the things that we do at peer-to-peer. One of the things that we do is give informational presentations to other students about substances. This year, we presented a slideshow that we made to the human and social development classes at Las Lomas, which consisted of mostly 10th graders. In addition to these presentations, we also have bi-weekly meetings to discuss our upcoming plans and club activities. Lastly, at peer-to-peer, we often make infographics and posters that we can post on our Instagram account or put up around Las Lomas' campuses. Next slide, please. Finally, I just wanted to give some examples about some of the posters that we've made in the past. As you can see on the right, this is a poster that I made not too long ago that outlines the signs of an overdose and what to do if you see someone currently incapacitated due to drugs. I've also made another poster that aimed to spread awareness about fake pills that isn't shown in this presentation, but essentially it just asks students to be wary of what they're consuming if they happen to have gotten their hands on fake pills. It's difficult to say the impact peer-to-peer has on the students of Las Lomas, but I firmly believe that it is important to have an outreach group like peer-to-peer that works to address the problem of substance addictions with teens and disseminate information to make sure students are safe. Thank you for listening.
Thank you so much, Ms. Whalen and Ferris. And thank you for sharing your story. We're getting some follow-up questions about the formation and kind of the role of the circles. So we'll answer that at a later time during our webinar. Next, I'd like to take a moment to introduce Laura Didier, who will provide a parent perspective. After tragically losing her 17-year-old son, Zach, to a counterfeit pill in Rockland, California in December of 2020, Laura began her partnership with Song for Charlie, a family-run nonprofit focused on educating students and caregivers on the dangers of fentanyl and counterfeit pills. Utilizing Song for Charlie's free resources, she gives counterfeit pills and fentanyl awareness presentations to students, parents, and community organizations. She has participated in the creation of multiple public awareness campaigns in Northern California. Laura also mentors youth who want to step into the role of a peer educator in their schools and communities. It's my absolute pleasure to have Laura join us now.
Thank you all so much. I'm incredibly honored to follow Ferris. He and I had the pleasure of participating in that panel discussion that Ms. Whalen spoke about, and it's just so impressed when I'm able to work with youth and see them step into these leadership roles. It's very, very inspiring. And before I speak to you all today, I would like to play this short video and introduce you to my son, Zach.
You ready? Me too.
And thank you, everybody, for the hearts. That's really touching. I appreciate that. Next slide, please. I guess I should also give credit to Jake as well, the vocalist in that piece. Zach obviously curated that, directed that video, but none of us had seen that video until after he passed away. And he had recorded it about 2 to 3 months before his passing. And I do like to start with a video of Zach because whenever I'm presenting his story, I really think it's important for people to see how he lived before they hear about how he died, because I feel that Zach's story it's really emblematic of this new wave of the drug crisis in our country. We are losing teenagers like Zach in numbers that we never used to see in our country. As you can see in this slide, all of the things Zach was involved in. He was a track athlete at his high school, Whitney High School. He was very active in his scout troop, working toward his Eagle rank when he died. In the bottom picture, you can see all his best friends holding him up. That was opening night when he starred as Troy Bolton in his school's production of High School Musical. Then the other 2 pictures in the corners come from his senior photo shoot. Unfortunately, he will always be a high school senior, as he was killed 6 months before graduation. And when I lost my son, Zach, in this horrible and tragic way, I had never heard of fentanyl. This was 2020. It was Christmas break of 2020. And then on December 27th, when Zach hadn't come out of his room for lunch, my older 2 kids were studying at home. It was COVID lockdowns. So all of our children were at home. They were at their dad's that day. I had just been with them on Christmas Day, and Zach wasn't up and about yet. So Chris went to check on Zach and tragically found him at his desk. He appeared to be asleep, but upon closer examination, Chris could see that he was cold and unresponsive, and any attempts to resuscitate him were unsuccessful. And my daughter had to call me to get over right away. At the time I got there, a few minutes later, they had concluded that Zach was gone and started their investigation. Zach had no history with substances or any health problems, and they did not find any drugs of any kind in his room. So it was really a mystery why he would be gone in this sudden and tragic way. But when the coroner came to get Zach that day, that was when we first heard of fentanyl. It was nothing I was aware of, certainly had never heard of counterfeit pills. And as we got into his phone and pieced together the last 2 days of his life, we did find that a seller of counterfeit products was operating on social media and had connected with Zach to sell him a pill that was marketed as a prescription medication, but it was a counterfeit pill made completely of filler material and fentanyl, and it ended his life very quickly. Next slide. So when I came to understand what had happened to my child, it was very important to me to warn other kids. It was clear that Zach's friend group was not aware of what was going on, and I really did not want to have lost my son in vain. So I did some research and I found Song for Charlie. And tragically, Charlie was a young man who also lost his life to a counterfeit pill. And his parents, Ed and Mary Turnan, had started Song for Charlie. Were really just getting it off the ground. And their mission resonated with me, warning young people, educating parents and teachers and school nurses what's going on and how can we get this information, right to kids directly. So I go, as you've heard, I go and speak to student assemblies, parent information nights. I want to make sure that everyone understands what's going on. In our slide deck, all of our materials are free for teachers and administrators and school nurses to utilize in their education efforts. We like to use big, bold images that will really land with kids that they can take away remembering. So in this particular slide, this is where we make the distinction between the pharmaceutical fentanyl that they might encounter in a hospital setting that's used very safely, that's created in a lab like what you would see on the left side of the screen, very clean, highly regulated. You know what you're getting, you know the dosage, and you're being carefully monitored in that setting, as opposed to what you see on the right side, which is where these counterfeit pills are being made. This is an actual photograph from a lab that would be manufacturing these counterfeit type pills. And so you can see there's no quality control or sanitation or proper dosing, and that's why these pills are so dangerous. Next slide. Another image that we find is really powerful with youth is using this chocolate chip cookie analogy. We know in my son's case that the pill that killed him was not the first one that he tried. He had tried one 2 days before. He and a buddy had this person that was selling these products had connected with them at the local mall. If you're in Rockland, Roseville area, you're very familiar with Galleria Mall. And the pills the boys tried on the 24th of December must have been much like the cookie on the right. Not much fentanyl. You can think of the chocolate chips as fentanyl. And when they are producing these pills, there's no content uniformity. And one pill might be loaded with fentanyl and one might not be, like these cookies. So the boys were okay on the 24th, but tragically, unfortunately, Zach decided to try one more on the 26th, and that was a pill that was loaded with fentanyl. And he didn't have any chance against that pill. He was alone in his room, and he just fell asleep and unfortunately never woke up. Next slide. And this is a very new crisis in our country. Fentanyl is the most potent opioid we've ever seen in our country, and these counterfeit products with fentanyl are incredibly deadly, incredibly addictive. It's really important that our parents are educated because it's a different landscape than we grew up with. It's even a different landscape than my older two children grew up with. That's how quickly this has evolved. And that's why it is so important that we educate our students on this. And that's why at Song for Charlie, we wanted to develop tools that schools can use, that teachers can use, that nurses can use. I presented to the Nurses Association in San Francisco Unified School District. We want to make sure that all of our campuses are aware these resources exist. They are free to be utilized. And lastly, I really love working with the youth. There's so many amazing students like Ferris that want to step into these leadership roles. And so that's a newer position I've taken on this year, really arming students with any kind of resources that they need, that we can share with them, that they can then take onto their campuses, into their communities to be educators on this crisis. So I'm incredibly grateful to the California Department of Education for working with us on this webinar, the California Department of Public Health, you'll hear from, California Department of Healthcare Services that we've done a lot of work with at Song for Charlie. I'm really grateful to be a part of these teams working together to make a difference because we need to save families from going through this. So thank you very much for listening.
Thank you so much, Laura. Our hearts are with you, and you are getting so much love and will always. You have our infinite gratitude for all you do. I would like to take the opportunity to introduce Andrea Foster. Andrea is a nationally certified school nurse and holds a psychiatric mental health nurse practitioner master's degree. Currently, Andrea is the administrator of health services, CWA, Foster Youth, and McKinney-Vento within the Integrated Student Services Unit for the Orange County Department of Education. She previously served as the coordinator of health services and home hospital instruction for Santa Ana Unified School District. She works closely with community partners, school nurses, and educators to provide supportive services and resources and to provide healthy environments to over 300,000 students and families across the county so that the students are able to access their education and become productive, successful adults. Thank you, Andrea, for being with us here today.
Hi, good morning. It's a pleasure to be here with you today. This segment will cover trends, overdose look-fors, first aid response, Narcan at school, things to consider, utilizing your nursing staff effectively, and prevention. Next slide, please. The next few slides are trends seen across LA, Orange County, and the state. Los Angeles County has reported on 4 high-impact areas. Group impact, being adults aged 26 to 39, have the highest rate of overdose, emergency department visits, and hospitalizations due to fentanyl. This is important to remember because we're not only looking out for the safety and welfare of our students, but also the staff, volunteers, community that are on our campuses. Gender disparity. Males are 4.6 times more likely to die from a fentanyl overdose than females. Socioeconomic influences. More affluent areas report higher numbers of fentanyl overdose deaths compared to the less affluent areas. However, it affects every socioeconomic status level. Drug prevalence shift. Fentanyl has surpassed methamphetamine as the most common drug type causing death in accidental drug overdoses. Next slide, please. Drug and alcohol overdoses or poisonings resulted in 13,000 emergency department visits, 6,600 hospitalizations, and over 1,000 deaths in Orange County for 2020. In the graph, you will notice that the 45 to 64-year-old age group had the highest number of overdoses related to fentanyl. Age group that felt the steady increase is the 24 to 44 age group, and the most dramatic increase was between the years of 2019 and 2020 in the 15 to 24-year-old age group. Next slide, please. The elevated numbers in overdoses aren't related to the increase in illicit drug use, which, according to UCLA, has declined over the years, excluding marijuana. Instead, the increase is the result of drugs becoming deadlier due to the fentanyl, which is found in counterfeit medications and the ease of access to these counterfeit medications. UCLA recently identified hotspots across the U.S., and I have listed the California counties on their list. These are the counties that had at least 20 overdose deaths and death rates that are higher than the national average for the year 2020 to 2022. Next slide, please. Nurses in the school setting are reporting increased numbers of drug impairment assessments, more EMS transports to the emergency department for potential substance use, seeing more polypharmacy, multiple medications and/or alcohol, more co-occurring morbidity with mental health diagnosis, increased numbers of overdoses on and off campus, and more referrals to mental health and substance use treatment programs. Next slide, please. These are images and facts that many of us have already seen, but it is a great reminder that any risk is too big of a risk. Next slide, please. What should we be looking for in a suspected overdose, and how do we assess the individual? You may see a combination of any of the following symptoms. Evidence of ingestion next to the person. Please do not touch unless absolutely necessary. If you can move the item away with your shoe, please do so or wear gloves to remove it. Decreased level of consciousness. Try to wake the person up. Slow, shallow, and absent breathing. Watch the chest and stomach rise and fall. Lack of response to stimulation. Shake them, shout at them, grind your knuckles on their breastbone. Small constricted pupils. Poor skin color, especially lips, fingertips, lining of the eyes, and inside the mouth. All of these symptoms are emergent. However, poor skin color is a lack of oxygen in these areas and is critical. Next slide, please. If you identify the signs of a potential overdose in an individual, you should call for help. Call 911 and follow your school site safety plan. Administer Narcan. If you're ever in doubt, administer the medication. There are very few side effects, if any. Begin CPR or rescue breaths as needed. As the individuals stabilize, row them to their side in the recovery position. Stay with the person and monitor them until help arrives and you are released. You may need to administer additional doses of Narcan or start CPR at any time. Next slide, please. This short clip will instruct you further on the administration of Narcan. There are several different brands and several different administration types. However, the one you will see in this video is most often seen in the school setting. We can go ahead and begin the video.
Narcan is an opioid blocker. It's going to go into the bloodstream and knock any opioid off of the receptor. And it's going to reverse that overdose so that that person has a chance at life. We're using the term Narcan, which is a brand name. The actual generic is naloxone, and there are many brands. The side effects of intranasal naloxone or Narcan, if somebody was not actually overdosing, the chance of having a serious health problem as a result are very small.
This is what Narcan looks like. If you're ever in a situation where you're going to administer Narcan, you should have already called 911. To administer Narcan itself, all you have to do is take it out of the package. It looks like this. You're going to insert the plunger into the person's nose, either nostril, and then press the pink button down. After that, you're going to want to clock about 2 minutes. The person should respond to the Narcan within those 2 minutes. If they're unconscious and not breathing, you will literally see them go and begin breathing again. If that doesn't happen within the first 2 minutes, continue doing that every 2 minutes until the person responds. If they don't respond after 3 doses, you're going to want to start giving rescue breaths.
One more thing to remember about Narcan is that anytime it's given, a person needs to go to the hospital. Opioids can last longer than Narcan. So the Narcan might reverse the overdose initially, and then the Narcan wears off, and guess what's still in your bloodstream? The opioid. Can find those receptors and they can re-OD.
Narcan and naloxone in general is now approved over the counter. Everyone should be trained in how to recognize and respond to an overdose.
Next slide, please. School districts are on the list of eligible organizations to receive free Narcan for their school sites. You can go to the website listed here and in the resources to start the application process. Once you receive your Narcan, determine where the Narcan will be located. Many schools locate it with their AEDs. If you do not have AEDs, you might consider the health office in areas where it's easily accessible. In addition, if you have AEDs, consider keeping a list of individuals trained in CPR for quick access. Determine who will be monitoring the storage of Narcan, the expiration dates, reordering, training for the Narcan, and utilize the formal process for requesting volunteers to be trained annually. And make sure all staff members are aware of where the Narcan is located. Next slide, please. Here are some things you may want to consider. If you have an overdose on campus, consider if it's possible others have ingested or could ingested the same substance. You will want to start an investigation immediately. Do you have an early warning system for your staff to be on the lookout? Know your average EMS response time. Make Narcan and overdoses part of your school site safety plan. Whom do you notify? Where is the Narcan and AED located? Who is CPR trained? Who will provide care if your nurse is off campus? Who will direct EMS? Who is on crowd control? Who is investigating possible additional cases? How does your team pull together if there are multiple cases? How does your plan change for extracurricular activities? Make time to practice your response system. Know your local resources for referrals and treatment options. Consider a transition plan back to school after any overdose or during and after treatment options. Next slide, please. Build capacity with your staff. Your nurses can assist you beyond the emergency response system. They can and do the following: Provide education and awareness of fentanyl and other opiates, emphasizing the risk of overdose. Educate teachers and staff on how to recognize signs of opiate overdose and how to respond effectively. Offer information sessions for parents to raise awareness about the opiate crisis and its impact on adolescents. Prevention programs. Supporting drug prevention programs that address opiate misuse. Establish peer support groups where students can discuss issues related to drug use and seek help. Emergency response preparedness. Ensure that Narcan is readily available in the school and that staff are trained to use it. Develop and regularly update emergency response protocols for opiate overdoses, including steps to take when an overdose is suspected. Participate in your district and site level EOC and site safety plans. Health offices, they can conduct screenings for substance use and refer students to appropriate healthcare providers and addiction treatment services. Please do not use these screenings to diagnose substance use or to use it as evidence in suspensions. Brief interventions, motivational interviewing, alternative to suspension programs, providing Tier 1 and Tier counseling for students and families, coordinate access to counseling services for students struggling with substance abuse issues, both internally and external resources. Collaborate with community resources. Collaborate with local health departments, substance abuse programs, and community organizations to create a network of support for students. Distribute educational materials and resources provided by community health organizations. And advocacy. Advocate for policies at the school, district, and state level that support substance abuse prevention and treatment programs. Seek funding opportunities for programs and resources to combat opiate use. Next slide, please. Prevention is key. Utilize all the available tools to educate students, staff, families, volunteers, and allies. Be prepared when these strategies, in case prevention efforts fall short. This is the end of this segment of the presentation. Thank you so much for allowing me the opportunity to bring you some of these resources.
Thank you, Andrea. That is great and important information. I have the honor of introducing Christopher Pepper as our next panelist. Christopher Pepper is an award-winning teacher and writer who helps lead health education efforts in San Francisco public schools. He writes the Teen Health Today Substack newsletter and is the co-author of the upcoming book, Talk to Your Boys. He serves on the content advisory board, thenewdrugtalk.org. Thank you for being with us here today.
Thank you so much for having me. My background is really as a health educator in the classroom. So I'm thrilled to be here today with several hats, both as a parent and as an educator and as someone who helped develop this, some of the resources that we're talking about today. Because I think this is a problem that reaches across communities and really needs a community-based response where we're trying to make sure that everyone in and around a school community receives the same high quality of information about this issue. One of the resources that we've developed is called the newdrugtalk.org. And so the URL for this site is on the screen. We can go to the next slide. And this is really a resource to help adults have conversations with young people about fentanyl. And the reason it's called the New Drug Talk is because it's really in recognition that this is an issue where the drug landscape has actually changed. The substances that people are encountering have changed. And so our old techniques that we used to use, things like just say no campaigns, really aren't appropriate for addressing this new situation that we've found ourselves in. So on this site, you'll find tips for having talks with young people that are very grounded in real life conversations, things that we know as teachers and as parents and as caregivers, these are the questions that come up regularly in our conversations, and it's all with the aim of preventing this from happening, preventing the kind of situation that happened with Laura and her son Zach from happening to other families, because we want to keep our kids alive. We want them to survive through this time, and it's in recognition that the substances that are available now are more likely to introduce a kind of immediate overdose that could be deadly. And so that's how things have changed, and that's what we want people to be aware of. We can go to the next slide. So on this site, the newdrugtalk.org, you'll find actually a place to practice those conversations before having them. So if you click around there, you'll get these talking tips about that are scenario based. How do I actually talk about this with a young person? And that can be really helpful when you're rehearsing how to do this. And I encourage you to practice ahead of time, but I encourage you to really have these conversations. Sometimes people are afraid to speak up because they're like, oh, I might not say the right thing, or I might get something wrong. We're providing a lot of resources today to help you get things right, but it is much better to take a chance and try to have those talks than to say, oh, I don't want to do it because I won't do it perfectly. Just try, make an attempt, and use these resources to help you along. We can go to the next slide. On the site, you'll also find videos. We've seen some examples of those videos today already. So if you're wondering where those videos came from or how you can watch them again, or you'd like to watch more videos, you can go to this site, thenewdrugtalk.org, and find those videos. You'll also find a 30-minute documentary, which includes a lot of the clips all together in one viewable item. And we have had success in doing community meetings where we promote that as a film screening. We show the whole 30-minute film and then have some panelists talk afterwards. So that if you're trying to reach a community or reach a group of adults, either teachers in a teacher training or parents, if you're doing a parent night, things like that, that's a great resource. And overall, the New Drug Talk website is a good resource to send out in communication. So if you're an administrator, sending it out in school communications. Sometimes people do this at the beginning of a school year or around school events where substance use sometimes occurs, like proms or graduation nights or things like that. To use that as an opportunity to send out this tool that was developed with state funding and has the blessing of the state of California as a trusted resource to send this out to families and help them all know about how you're addressing this. We can go on to the next slide. When we're talking about this with youth, you can use the resources from that same site, thenewdrugtalk.org. Some teachers have had good success in using those. And I recommend pairing them with resources from songforcharlie.org, which is the organization that developed the New Drug Talk. Song for Charlie's resources are really aimed at youth. We can go to the next slide. And you'll see on the Song for Charlie website, resources that are easy to share on social media. They're easy to pull into a classroom setting. They're easy to share with families in a newsletter. And they are all free to use. We can go to the next slide. So you saw some of the slides earlier from other presenters who highlighted a few things, but all of them have the same kind of look, graphical, easy to understand messages that are designed with young people in mind to try and communicate this and help people understand that this drug landscape has changed, the situation we're dealing with is different. And one of the things we really emphasize with young people is that often they're not taking fentanyl on purpose. This is something that is getting into pills that are sold as other things. So people think that they're getting a prescription medication, but they're getting it from a friend or from someone on social media. And it turns out that it's not that prescription medication. It's actually a fake pill that includes fentanyl. And even a little bit of fentanyl can be fatal. Even a tiny bit of fentanyl can be fatal to a user. So we try to communicate that and make it really clear that pills and powders in particular are risky substances to use because fentanyl is found in so many of them these days. We can go on to the next slide. I love having health education in schools. I really encourage schools to have wellness centers and health education classes with trained teachers to try and keep those teachers up to date. So providing training and resources to keep those teachers up to date and make sure that the teachers across a district or across a school are all sharing similar messages. And one of the advantages of presenting this information in a health education context is that you can talk about other things that might keep people away from substance use, which is all about feeling good. If you're a student, feeling good about yourself, feeling comfortable, having friends, and doing basic things to take care of yourself, like getting good sleep, doing some mental health work like breathing and meditation, and eating well, and just making sure that everyone at a school feels accepted and included and a part of that school community. We can go on to the next slide. So in a health class, I would definitely return to some takeaway messages. Like, you heard this whole presentation. Let's go back to some things that we really want you to remember. And the main one is no random pills. Don't take anything that's not from a doctor or pharmacy, that's not prescribed to you. We heard about the chocolate chip cookie effect, the idea that there could be fentanyl in a pill that's distributed unevenly. So if something's in a pill form and someone says it's been tested, that's not really a reliable, that's not something you can rely on. We talked about using Narcan and helping young people understand that there is a medication available that can reduce overdoses. And then just taking care of yourself and spreading the word to keep yourself and your friends safe. We heard and saw a great example of that from Ferris and the peer work that's happening in their school. That can happen in every school. These messages should be going out to every school. And I appreciate you taking the time to hear these messages. And then I would love to have you take them back to your own community and school so that we can get the word out about this across the state. Thank you. Two other things that I wanted to share before we close with this section. We can go to the next slide. Our specific resources for classrooms. These are two lesson plans essentially that we're going to share. The first one, we can go to the next slide, is from a school district in Beaverton, Oregon. So they developed a lesson called Fake and Fatal. This lesson is available in a middle school version and a high school version. And they made it available for free just as a benefit for the community. So at this URL, you can download the lesson. You can take a look and see if it would be appropriate for your school or your school district. And then one other slide, we can go to the next slide. This is from Stanford University. This is their lesson on fentanyl and opioid awareness and overdose prevention. This is a slide-based lesson. It's in Canva slides, so people can click through and use the notes in those slides to present a lesson about this topic. And both of those lesson plans are available for free for anyone who would like to use them. Thank you.
Thank you. Thank you, Christopher, very much. I really think having a teacher perspective on what it looks like in real practice in real time is very powerful, and I can tell you're passionate about it. So thank you for your time. I know we've met numerous times and your commitment to helping the students. So next, I have the honor and privilege of introducing our next panelist, Ryan Skaggs. I work closely with Ryan and his team. He's the chief that joined the CDPH Office of School Health from the Office of Policy and Planning, where he served as the Lean Transformation Section Manager since the OPP's establishment. He began his career with CDPH. Oh, I don't know if I said what CDPH is, California Department of Public Health. Sorry about that. As a student intern in 2017 and has served in a variety of roles, including strategic planning coordinator, internship coordinator, and program consultant with the CDPH Office of Oral Health, where he played a leading role in helping implement school-based and school-linked health programs and other strategies to support community clinical linkages serving California's children. He has strong experience working in children's public health programs. Ryan is a Clinton Global Initiative Fellow with a background in environmental justice, community organizing, nonprofit management, and HIV client services. Ryan, would you come join me up here?
Yeah, thank you, Carrie, and good afternoon, everybody. As Carrie mentioned, I'm Ryan Skaggs from the California Department of Public Health, Office of School Health. Next slide, please. So this is a little bit about our office. We are a newly formed office in CDPH. Our mission is to advance health, wellness, and safe in-person instruction for California's 7.5 million students and staff within the state's 10,000 TK through 12 schools. So how we do that is supporting local education and local health stakeholders in their work together to make California schools healthier and safer. We started as a COVID-19 focused program. Some of you may be familiar with the Safe Schools for All team. Definitely have a lot of experience in developing and disseminating scientific guidance and policies on matters of public health importance. And as I mentioned, we started out with a heavy focus on COVID-19. And recently, with the establishment of the Office of School Health, we focused on a wide range of health issues, and definitely overdose prevention is a very big focus of ours and very near and dear to our heart. So we believe strongly in collaboration between state and local education and health officials. And one of the big ways that we do this is through maintaining different platforms for communication and convening. We host a weekly office hours session on Tuesdays. A big part of the community that we serve are school nurses, school administrators, as well as those working in local health departments. Next slide, please. So today I'm going to talk about some resources that schools can use to implement overdose prevention policies. Also cover a little bit some of the material that some of the other presenters have covered as far as like how to recognize signs of an overdose, more about naloxone and how to get trained in naloxone. I think that it's also important to just reiterate those points just so that, you know, some of the folks on this webinar today can really feel empowered to, you know, take the steps that they need to do and make the type of decisions that can help them understand if, you know, they want to support, you know, naloxone policies in schools, if they want to carry naloxone as a person. And there are a wealth of resources out there to support school naloxone programs. And also a lot of resources that we can offer and technical assistance that we can provide to schools in helping to understand, you know, what type of naloxone policies are right for them and what type of considerations they may want to look into. Next slide, please. First resource I want to provide is the California Overdose Surveillance Dashboard. A little disclaimer here that the data on this dashboard is not specific to schools. The data can be disaggregated by both state level data and county level data, but it's a good source of information if you're interested in learning more about your communities, you know, deaths from opioid and fentanyl overdoses, as well as emergency department visits, as well as the prevalence of prescription opioid use in your area. This can be especially useful to administrators who are trying to understand what type of overdose prevention resources might be right for your schools or your district, as well as just getting a better understanding at, you know, the current situation in your community. Next slide, please. So again, it's important to know the signs of an overdose. I think a couple of our other presenters have covered these as well. Just want to, you know, cover some of the key ones again. Small and constricted pinpoint pupils, those are a very, you know, telltale sign of a potential opioid overdose. This is definitely applicable to fentanyl and Oxycontin, as well as some older drugs, including, you know, morphine, heroin. The small constricted pinpoint pupils are a very telling sign that it could be a suspected opioid overdose. Also, you know, signs that someone may be having trouble, you know, staying conscious, as well as, you know, signs that someone may be having difficulty breathing are especially important to pay attention to. And again, I think, you know, knowing the signs of an overdose are really important. especially given the prevalence of fentanyl in California street drug supply. Next slide, please. So again, a lot of our presenters have covered naloxone as well. I just want to reiterate that naloxone can save a life and can reverse an opioid overdose. It's important to be trained in naloxone, to administer it correctly. It is available as a nasal spray, also can be injected through using an auto-injector or a syringe. It's very effective, it's safe, it works quickly, it's not addictive, and want to just reiterate that if no opioids are present, it will have no effect on someone, and it has no potential for abuse. So, and it's available for free to schools through the naloxone distribution project. And with recent changes to the law too, it is also available over the counter at pharmacies at your own cost. Next slide, please. So again, absolutely important to become familiar with naloxone, to look into training for naloxone. CDPH has a wealth of resources on naloxone that you can use if you are stocking naloxone in your school. Some really important ones I think are on this page, and we will be getting some of all these links out to the audience here today. Just some informational resources about what naloxone is, naloxone policies on youth, and how supportive adult role models can help with addiction and overdose prevention. Also, CDPH has an excellent 11-minute training video. If you are stocking naloxone in your schools, highly recommend this training. It'll give you everything you need to know about how to respond in the case of a suspected overdose, how to administer naloxone. Incredibly valuable resource. And I, as a person, carry naloxone, like many people who work for the state. I work in downtown Sacramento, which has a large unhoused population. And so for me, knowing the signs of suspected overdose, knowing what naloxone is, and being trained to administer naloxone, I know that, if there's an emergency, I can save a life. So again, knowing how to spot the signs of an overdose, being trained in administering naloxone and having naloxone, you can save a life too. So just want to reiterate that. And I know a lot of the other presenters today covered a lot of great information on this topic. Next slide, please. So again, we're going to be sending some of these helpful links out to those on the webinar today. Again, the naloxone distribution project, we've talked a lot about that today. They do ship free naloxone to schools. They've been around a bit. They've been around since 2018. And in that time, they've distributed over 4.5 million kits of naloxone. And those kits have been used to reverse over 250,000 suspected overdoses. So big program, absolutely been incredibly effective at getting naloxone out to organizations who work with addicts, organizations who work around those who might be at higher risk of an overdose. Can't stress enough how valuable of a resource that is. And again, naloxone is available over the counter now, and so schools can go into pharmacies and purchase that at their own cost. Another resource that is available is the CDPH naloxone standing order. The naloxone standing order came from an era where a prescription was necessary to obtain naloxone, so it was a tool to help schools and others to be able to, procure naloxone from a pharmacy. Although naloxone is now available over the counter, still highly recommend this link because it has a lot of great information and resources that you can use if you're interested in learning more about naloxone or developing overdose prevention policies in your school or your district. Also, the Overdose Prevention Initiative landing page, again, a lot of the information that I've been talking about today can all be found here. So next slide, please. This is the Office of School Health Safe Schools for All hub. It's a one-stop shop for all things school health. Definitely highly recommend it, and we'll be sending out the link to our schools hub as well. Again, this has a lot of great links and resources if you are interested in implementing a overdose prevention program or naloxone policies in your school or your district. There's a lot of information that may also be pertain to school nurses, teachers, and others who work in schools. So the School Hub is a great resource for any and all school health issues, and especially around fentanyl, overdose prevention, addiction prevention. Again, like I mentioned in the beginning of my presentation today, just a very big issue and a very big focus for us. Next slide, please. So we also have a survey that we will be linked that we can go ahead and post in the chat as well. CDPH is partnering with Sac State University to try to collect data from schools to better understand how we as a state can support schools and districts and counties with implementing overdose and substance use prevention policies. So by taking this survey, you'll really help us understand how we can serve you and support you better. So please do that, and we'll get the survey link out to everybody. Next slide, please. And here's some contact information. So again, if you have any questions about the naloxone standing order or the overdose prevention initiative, you can use those first two links on our the resources that we'll send out. And to reach our team for technical assistance, you can reach out to us at the Safe Schools team shared inbox. And again, we are a resource that's available to you to help you make the decisions that's best for your school and your community. Definitely highly recommend working with your local health department and engaging them for subject matter expertise, as well as working closely with your own legal counsel when trying to understand what types of overdose prevention policies might be right for you, and a lot of those questions on the implementation side of things. But again, want to reiterate that we are a resource that's available to schools in California and happy to help you out. I think that's it for me today. So thank you.
Thank you very much, Ryan. Always appreciate learning more from you each time you take the stage. So now we're going to transition to the question and answer section. We are really at that last minute, but I wanted to make sure I've been trying to answer throughout our time together today, but there were a couple questions that I was going to ask if Amelia would come off mic, and Amelia, oh my gosh, Andrea. No, sorry, Amelia, Andrea, it's all good. If you wouldn't mind, there were some specific questions about storing your naloxone in your own classroom or in your own wellness center, and then about the formation of circles.
Yes. So in terms of storage, we always ensure it's at the proper temperature, and also that everyone is aware of exactly where it is in the wellness center, which for us, it's right in the front desk, and it's labeled and everybody knows where that is. And we work with the school nurse in terms of determining that things are stored properly. In terms of the forming of the circles, it's facilitated by wellness staff, but really like a lot of student participation. And the way that we promote them is we try and do it in a lot of different ways. Like we use our traditional communication mechanisms like our social media page and, our school newsletter. But beyond that, we really draw upon our youth to do more direct kind of targeted recruitment of peers. So like, for example, the peer educator group that Ferris is a part of, also within our leadership class, we have a wellness committee. And we really ask them, like, reach out to your classmates of all different ages and social groups and encourage them to attend. And kind of what we've seen is there's almost like a snowball effect. Kids really respond to this information. They see how serious it is. They're concerned for their peers. They're concerned for themselves. And what I've seen is really like they feel a call to action. So from there, a lot of participants encourage friends to come and participate. So it's kind of an organic process. Also, an aspect of what we do here is we don't just provide direct clinical counseling, we do a lot of programming, and we have a community space. So many of the relationships we have with students are like kind of informal, and we'll tell kids like, hey, why don't you come check out this event that we're doing? So really with us, it's like we cast a wide net, but then we find they respond well enough to the curriculum and the format that they tell their friends, and that's a major recruitment mechanism for us. I hope that answers the question.
It does. Thank you, Amelia, very much. So this concludes our time together today. And I just want to take a moment to thank all of the panelists. As you can see, they are the experts and provide so much information that is really something that we all can learn from. Through their lens, we will continue to do the work necessary to not only bring about awareness, but also resources to our school communities. I'd also like to thank our sign language interpreters and all of the participants who joined us here today. This has been recorded, and we will make that accessible as well as the slides. And I hope you all have a wonderful rest of your day. Thank you so much.